Welcome to our journey of discovery, where science meets sustenance and health blooms from the bounty of nature. The health benefits of a vegan diet. Science-backed evidence. Physicians are becoming more involved in helping their patients adopt healthier lifestyles. Healthy eating may be best achieved with a plant-based diet, which encourages whole, plant-based foods and discourages meats, dairy products, and eggs, as well as all refined and processed foods. Research shows that these diets are cost-effective, low-risk interventions that may lower body mass index, blood pressure, and cholesterol levels, and may also reduce the number of medications needed to treat chronic diseases. The objective of this video is to present to physicians an update on plant-based diets. Concerns about the rising cost of healthcare are being voiced nationwide, even as unhealthy lifestyles are contributing to the spread of obesity, diabetes, and cardiovascular disease. For these reasons, physicians looking for cost-effective interventions to improve health outcomes are becoming more involved in helping their patients adopt healthier lifestyles. Healthy eating may be best achieved with a plant-based diet, which we define as a regimen that encourages whole plant-based foods and discourages meats, dairy products, and eggs, as well as all refined and processed foods. We present a case study as an example of the potential health benefits of such a diet. Research shows that plant-based diets are cost-effective, low-risk interventions that may lower body mass index, blood pressure, HbA1c, and cholesterol levels. They may also reduce the number of medications needed to treat chronic diseases and lower ischemic heart disease mortality rates. Physicians should consider recommending a plant-based diet to all their patients, especially those with high blood pressure, diabetes, cardiovascular disease, or obesity. Definitions of plant-based diets. The presented case is a dramatic example of the effect a plant-based diet can have on biometric outcomes like blood pressure, diabetes, and lipid profile. The reduction in HbA1c from 11.1% to 6.3% in 3 months is much better than would be expected with monotherapy with metformin or daily exercise. The improvement in blood pressure, observed over a 4-month period with few medications, is also rarely encountered in clinical practice and is likely related to a low-sodium diet and the avoidance of red meat. Because the patient was not obese and did not have significant weight loss with the diet, the dramatic improvements appear to be related to the quality of his new diet. A healthy plant-based diet aims to maximize consumption of nutrient-dense plant foods while minimizing processed foods, oils, and animal foods, including dairy products and eggs. It encourages lots of vegetables, cooked or raw, fruits, beans, peas, lentils, soybeans, seeds, and nuts in smaller amounts, and is generally low-fat. 8.9 leading proponents in the field have varying opinions as to what comprises the optimal plant-based diet. Ornishi Al recommends allowing animal products such as egg whites and skim milk in small amounts for reversal of disease. Esselstein, who directs the Cardiovascular Prevention and Reversal Program at the Cleveland Clinic Wellness Institute, recommends completely avoiding all animal-based products as well as soybeans and nuts, particularly if severe coronary artery disease is present. Despite these smaller differences, there is evidence that a broadly defined plant-based diet has significant health benefits. It should be noted that the term plant-based is sometimes used interchangeably with vegetarian or vegan. Vegetarian or vegan diets adopted for ethical or religious reasons may or may not be healthy. It is thus important to know the specific definitions of related diets and to ascertain the details of a patient's diet rather than making assumptions about how healthy it is. The following is a brief summary of typical diets that restrict animal products. A key distinction is that although most of these diets are defined by what they exclude, the plant-based diet is defined by what it includes. Vegan, or total vegetarian, excludes all animal products, especially meat, seafood, poultry, eggs, and dairy products. Does not require consumption of whole foods or restrict fat or refined sugar. Raw food, vegan. Same exclusions as veganism, as well as the exclusion of all foods cooked at temperatures greater than 118 F. Lacto-vegetarian. Excludes eggs, meat, seafood, and poultry, and includes milk products. Ovo-vegetarian. Excludes meat, seafood, poultry, and dairy products, and includes eggs. Lacto-ovo-vegetarian. Excludes meat, seafood, and poultry, and includes eggs and dairy products. Mediterranean. Similar to whole foods, plant-based diet, but allows small amounts of chicken, dairy products, eggs, and red meat once or twice per month. Fish and olive oil are encouraged. Fat is not restricted. Whole foods, plant-based, low-fat, encourages plant foods in their whole form, especially vegetables, fruits, legumes, and seeds and nuts in smaller amounts. For maximal health benefits, this diet limits animal products. Total fat is generally restricted. Benefits of plant-based diets. The goal of our diet should be to improve our health. In this section, we will review the literature for key videos that demonstrate the benefits of plant-based diets. Our review consists of existing studies that include vegan, vegetarian, and Mediterranean diets. Obesity. In 2006, after reviewing data from 87 published studies, authors Burko and Barnard 13 reported in Nutrition Reviews that a vegan or vegetarian diet is highly effective for weight loss. They also found that vegetarian populations have lower rates of heart disease, high blood pressure, diabetes, and obesity. In addition, their review suggests that weight loss in vegetarians is not dependent on exercise and occurs at a rate of approximately 1 pound per week. The authors further stated that a vegan diet caused more calories to be burned after meals, in contrast to non-vegan diets which may cause fewer calories to be burned because food is being stored as fat. Farmer A.L. Cortine suggests that vegetarian diets may be better for weight management and may be more nutritious than diets that include meat. In their study, they showed that vegetarians were slimmer than their meat-eating counterparts. Vegetarians were also found to consume more magnesium, potassium, iron, thiamine, riboflavin, folate, and vitamins and less total fat. The authors conclude that vegetarian diets are nutrient-dense and can be recommended for weight management without compromising diet quality. In 2009, Wang and Beisoon 15 analyzed the nationally representative data collected in the 1999-2004 National Health and Nutrition Examination Survey. The aim of their study was to analyze the associations between meat consumption and obesity. Using linear and logistic regression analyses, they showed that there was a positive association between meat consumption and obesity. The Oxford component of the European Prospective Investigation into Cancer and Nutrition assessed changes in weight and BMI over a 5-year period in meat-eating, fish-eating, vegetarian, and vegan men and women in the United Kingdom. During the 5 years of the study, mean annual weight gain was lowest among individuals who had changed to a diet containing fewer animal foods. The study also reported a significant difference in age-adjusted BMI, with the meat eaters having the highest BMI and vegans the lowest. Similar results were reported by the Adventist Health Study. Barnard et al. 21 reported in 2006 the results of a randomized clinical trial comparing a low-fat vegan diet with a diet based on the American Diabetes Association guidelines. People on the low-fat vegan diet reduced their HbA1c levels by 1.23 points, compared with 0.38 points for the people on the American Diabetes Association diet. In addition, 43% of people on the low-fat vegan diet were able to reduce their medication, compared with 26% of those on the American Diabetes Association diet. If you found this video insightful, don't forget to like, share, and subscribe to my channel. And as always, feel free to leave your thoughts and questions in the comments below. Thanks for watching.